clean, apply, scrub, dry.
I love it. We are so lucky that we've got the CLABSI Rangers, and they are going to tell us how you got involved in this, why you think it's important.
Elisa, our leader, actually brought us together to work on reducing central line infections in our ICU.
Well, CSI gave us a framework on how to put together a team of nurses from the bedside to choose the subject that was important to them and to tackle that.
Elisa Bowman brought me after the success of her past CSI project to reduce CODI in the ICU. They actually had a 92% reduction, and that really inspired us to form the CLABSI Rangers. We had a very high incidence of CLABSI the year prior that we initiated our project. So we really wanted to look at why that was and if there were educational gaps that we could address.
And so what have you found with your project?
We spent the first 3 months really pre-planning, combing through the data. We talked about how we were going to survey staff and find out if we could identify areas that were potentially causing our CLABSIs or potentially exacerbating the problem. So we really wanted to find out if there was some education that we needed to plan and provide. And then during that time, we utilized CSI forms actually to create our SMART goals. And we also tried to create like measurable and realistic goals. So we really wanted to make sure we had these intervals of 3, 6, and 9 months that we were going to hopefully reach our ultimate goal, which our first goal was to have 50% reduction in our CLABSIs in the ICU. We actually achieved an 80% reduction at the project end. We had various other goals. They were aimed at educating our staff, educating patients and families,
Recruiting champions.
So we wanted to, we knew that with our branding, we'd need to have a buy-in from our team. And so we wanted to recruit change agents and get key stakeholders involved. And we felt like the most crucial was bedside nurses in our unit. So we had a goal to recruit 10 champions. We actually ended up with 13.
And you mentioned that you had used the CSI Academy in a previous project. And so your hospital was already sold on it.
Yeah, so they saw the results. Heidi said that we had a 92% reduction. You know, our manager was the manager at that time as well, was really supportive of us. And she's like, yeah, let's do it again. Let's shorten it down to the 12 months, she said, but let's try it again and see what we can do.
Great. Now I want you to talk about your shirts and other branding things that you've done and why you did this.
So that's one of the things that CSI taught us in the past as well, was creating a good brand to get staff excited about it. And we're all in the Pacific Northwest. And so we went with a park ranger theme. We started out with the slogan, "Only you can prevent CLABSI," kind of like Smokey the Bear. We came up with this t-shirt design that's a kind of a park ranger emblem with central line lumens as the roots of a tree, symbolizing that a patient's central line is often their lifeline to life-saving medications, drips, transfusions, even parenteral nutrition. So it's like a key thing in an ICU that the patient really needs. And when we have a problem with infection, it can cause a lot of harm to the patient.
And then on the back of the t-shirts, we have, it's a mnemonic of CLABSI, which is the things that we have, how to prevent CLABSI. So when we're all walking down the halls, people look at this and they're reading it and trying to figure out, oh yeah, this is what our goals are, this is what we're going to do.
Yeah, we really tried to emphasize central line bundle and some of our current strategies that we were using to decrease CLABSI in the ICU. And so I think we added CHG bathing onto there as well, which we were doing chlorhexidine baths with our ICU patients. So we put that on. And we thought that if we were wearing our t-shirts, we wouldn't only impact our bedside nurses, but we'd also kind of generate conversations with patients and families about what we need to do as ICU nurses at the bedside to prevent central line bloodstream infections. And actually that was a big part of our initiative, was to really not only own the issue, but to hold ourselves accountable by opening up those conversations with the patient and family at the bedside. so that they could also ask us, what's that about? Why do I need the central line? Yeah. What should you be doing to care for it?
One of the other things we did to empower families and nurses at the bedside to have these conversations was put educational fact sheets about central line associated bloodstream infections in the room where a nurse could easily refer to it and provide some information to the family and educate them. And then we also put signs on what a nurse should be doing every time they access a line, scrubbing in the hub for 15 seconds, letting it dry. And a lot of families might not know that, but having the information there empowers them to know what should really be done with this
To ask the question.
life-saving device.
We had like a, what did we call it? Scrub,
Clean, apply,
clean,
scrub,
apply, scrub, dry. Clean, apply, scrub.
clean hands,
15 seconds.
apply new gloves,
Yeah.
scrub the hub for 15 seconds, and dry for
Dry for 5.
You have to do that every time you access a central line for appropriate care.
And it's right next to the clock. So you can watch the clock, watch your thing scrub.
You met your goals, and that is so important. So congratulations on this. This is great.
I mean, you're talking to us, but really we owe a lot to our unit. The ICU nurses on 6, 7, and 8 East at Swedish Medical Center First Hill ICU,
In where?
Seattle, Washington.
There's 2 other nurses that aren't with us, Sarah Gaddis and Sarah Potts. We could not have done it without the hard work of the bedside nurses.
Well, they are the ones that did.
They really are the ones that should be celebrating this, because they were the ones that did the work. And we did it alongside of them, but we could have not achieved this with just 5 of us.
Wonderful.